to Becky, please. Thank you, Becky.
Thank you, Chair. I'm Becky Cooper. I'm the MP for Worthing West. I wanted to move on to funding, if that's okay. So, Thea, perhaps if I could come to you, and others, please do join in. So, I wonder if you could remind the committee what the current envelope for NHS dentistry is, and then perhaps if you are able to say what you think the additional spending should be in order to get us to a comprehensive dentistry offer.
So it's approximately 3 billion at the moment. I think the question that needs to be discussed quite openly is, will any government bring back universal dental healthcare when all governments are faced with making very difficult choices?
So, Thea, if we brought back universal dental healthcare, I'm not at all saying that we will, what would the additional spend need to be?
I don't have a figure, but it would be billions. And the choice, therefore, within an amount of money within which decisions have to be made will be for a government to decide whether or not those people who have already chosen, forced to take private dental care, will be enabled to come back in to the NHS. What we said in our report, which was around the demise of NHS dentistry, was there needed to be a focus on comprehensively ensuring that those people who were vulnerable had really excellent access to dentistry, children, the vulnerable, the poor, etc.
So perhaps if we focus on that, so if we take out those people that are currently accessing private dental care, put them to one side for the moment, and look at the people who are accessing dentistry alongside those who should be accessing dentistry but aren't, do you know what the funding gap is there?
I don't have a specific figure, but I would think it is at least £1 billion.
£1 billion. Okay, thank you very much.
My colleague may.
Yeah, look, you know, the like I said earlier, the funding for NHS dentistry has decreased by at least about £1 billion over the last 10 years, and the first thing we need to do is restore that. I would say in NHS terms, I don't think we will need a lot of money to fix the system if the political will is there.
Okay, so just to be clear, it's currently 3 billion. Your expertise is in the room. An additional 1 billion would essentially go a great way towards meeting the unmet need gap right now.
Would certainly restore the funding that we had previously.
Okay, thank you. And so if I can just move on to the current spend. So, Thea, you very wisely talked about the commissioning underspend. So I wonder, for the benefit of the committee, if you could explain specifically why that is and what that gap currently is.
So, as your colleague talked about, ICBs have the role of commissioning, planning, dental services, NHS dental services, and for a variety of reasons over years they've had an underspend against that budget.
And so, sorry, could you give us a few of those reasons? That would be really helpful.
It can be because they haven't been able to find dentists in the area to spend it with. I and many others would question whether or not there is the creativity and the thought that could go into it. More broadly, what happens, and I'd go back to your colleague...
Thea, just to be really clear, so you do think there is an issue in that there aren't sufficient dentists in order to take up the contracts that are being tendered?
For some places that is. More broadly, the NHS is always looking to balance its budget, and in experience what will happen is a dental underspend will be used to balance off the budget of the ICB, which goes back to your colleague's question, which is why does dentistry never get to the top of the list or onto the table? Urgent and emergency care, corridor care, primary care access will always top it.
And I don't want to put words in your mouth, but do you think there's something deliberate then around not commissioning to the full extent of the budget in order to offset the urgent care requirements?
I don't think it will be deliberate. I think it will be the muddling through that people do in order to try and make the money work.
Okay, so do you think there's a case to be made for ring-fencing dental budgets?
There are lots of pros and cons when you get into ring-fencing. So there would be some pro in ring-fencing it, but equally you can be even more fluid if you don't ring-fence it. The history of ring-fencing budgets show on the whole a neutrality of outcome.
Okay, Dr. Pabry, do you have any thoughts?
Absolutely. I think, you know, this is something the Minister said, where he says the contract's mad, where you have an underspend and you've got queues of patients trying to look for care. And without sounding like a broken record, it is the contract that's to blame. We can't recruit. I work in an area where it's very difficult to recruit, and that's how we have clawback and we have an underspend, and it's a vicious circle. So yeah, I think it would be it is meant to be ring fenced, and there are good ICBs like ours who are using the ring fence to do some really innovative things, like the urgent access scheme that we have in the northeast. That's from the underspend. We've got supervised toothbrushing schemes. So we are trying to use the underspend. But I think fundamentally we need to come back to reform the current contract. Okay. And then we shouldn't have an underspend.
So perhaps if I can stay with that on innovation and perhaps move us into the area of inequalities and prevention. In terms of spend for the dental budget, do you have any sense of how much of that spend is actually going into improving oral health and preventing dental issues?
I don't have a figure, but the public health grant is also used for oral health promotion. And what we know is if you look at where the money has gone broadly since 2014, the budgets that suffered the most is the public health grant, swiftly followed by community services. So what you've got is a situation with a dental underspend, a difficulty looking at what to do with it. You can use some of that for oral health promotion. You've got examples across the country of directors of public health being really creative with the small amount of money that they've got within councils have taken some leadership on oral health promotion, but that budget has itself been seriously reduced over 10 years.
So in essence, just to clarify, the promotion and prevention of dental health is essentially left down to individual innovation within regions, is that correct?
Yes.
Just one quick thing. So the underspend is the way the NHS accounting system works. So by the time an ICB finds out that there's whatever the underspend is, and it tries to do its best to try and spend it as quickly as it can within that financial year, it spends some of it on commissioning ad hoc orthodontics or sedation, but a large percentage of that budget actually goes back. So it's just the way the system works. Because I under-deliver this year. They won't find that out till June next year. And by the time they find out what the underspend was, which is nearly $500 million over the last couple of years, but you can't spend that.
No, that does sound nonsensical. You're right. And do you think a certain percentage of and I appreciate there's a public health budget and a dental budget, so there may well be some conversations around how they are working together. Do you think a certain percentage should be utilised for oral health prevention? And do you think that should be stipulated or made mandatory?
Yeah, I mean, we've seen something in the announcements yesterday. We are seeing the rollout of toothbrushing in schools. It's a really well evaluated intervention, and it's really positive to see that happening. We also seen the use of dental therapists to do a range of interventions, which again is well evaluated and we would hope would see positive results. So I think whether stipulating an amount will go, I think it will still come back to this very boring answer that we all keep giving, which is you've got to fundamentally reform the contract.
Loud and clear. Sorry, Dr.
Can I just echo that in terms of prevention, and we've said this to government, that the supervised toothbrushing schemes are a good idea and we support that, and it's a really good thing for prevention. And also the fluoridation in my neck of the woods in the northeast, where the green light for fluoridation has been given, it's going to help another 1.6 million people in my region. So there are good things in terms of the public health measure that the government's done, but I still think we need to reform the contract.
Absolutely, contract heard. Just to go to the toothbrushing, I wonder if you could just, again, for the benefit of the committee, explain how that's going to work. Is that going to be yet another thing that the teachers are going to be expected to do?
Yes, and so I've had conversations with people doing this, and there are schools that have really embedded it very successfully and finding that it's helping and it's working well. But again, I'm sure you would find from your education colleagues there are many teachers who feel overwhelmed by something new to do. So we have a range of views, but as an intervention, it is a very successful one.
Sure, I suppose the concern would be, again, looking at inequality as to where the overwhelmed teachers are actually sitting in terms of our areas of deprivation. Sorry, Dr. Pebbery.
Again, I've had an argument about this with a teacher, and I've spoken to a dentist that actually runs such a scheme in Yorkshire, and it's very slick. The way that they work it in the morning, it works really well. It's about 5 or 10 minutes with the children, and it makes a huge impact. And it actually stops the kids having time off for dental treatment in the future. So it's really well invested money. For every £1 that you invest, you save £3. So it does make sense.
Now, I'm sure, Dr. Pebbery, I'm just thinking about our teaching colleagues and all the very many things they've had to take on over the years as the wraparound services have been taken taken away with the joys of austerity. So just one final question, Thea, if that's okay, and just coming back, my colleague just highlighted it, around ring fencing, and you said overall it's sort of a neutral intervention. Would there be the argument to say that if it was ring fenced, it would have to be spent? So going back to the underspend argument, that the underspend.
No, if you have a
wouldn't be
ring
there.
fence, you don't have to spend it.
You can still return
broadly
it.
speaking, if you haven't got something in the shop to buy, you can't buy it.
Yeah. Okay, so contract reform. Thank you very much.
Thank you.